When the ceasefire came into effect in early October, staff in hospitals across Gaza hoped for some respite. Instead, they are still fighting to save lives. For more than 2 years, the healthcare system stood at the center of a war that spared no one. The Israeli military besieged, raided, and bombed hospitals and clinics, stripping them of things that make survival possible.
There isn't a working MRI scanner in the entire Gaza Strip, and I find this absolutely mind-blowing.
Today, what remains is not a system recovering, it's a system enduring, carrying the weight of a war that never really left. Now, it's evident in the bodies of those who went too long without treatment, in wounds that have not healed, in kidneys that keep failing, in surgeries postponed until pain becomes permanent. Doctors here are trying to rescue what the war has slowly, relentlessly destroyed.
Getting things repaired is made so difficult because getting supplies in is limited. Some things are prohibited, some things are just delayed and delayed and delayed. So getting just basic diagnostic equipment up and running would make such a difference and make it so much easier for the good doctors and nurses in this hospital.
And for many Palestinians, that means survival depends on one thing Gaza cannot provide: a way out. Under the ceasefire, Israel agreed to allow 50 critically ill or wounded patients to leave the Strip every day. But the health ministry says since February, when the Rafah crossing was finally reopened, only 520 patients have left. Another roughly 20,000 patients are still waiting for permission. Ibrahim al-Kahlout is one of them. The father of the 3 was hit in the head by shrapnel, an injury that's paralyzed the left side of his body. Now, his children help him eat, drink, and move around. His hope is simple: to reclaim his body.
My only hope now is to receive treatment abroad. I had expected to get medical care outside Gaza during the ceasefire, but that hasn't happened, and here I cannot access the treatment I urgently need.
Families watch loved ones deteriorate while waiting for approval to leave. Hospitals are crowded with patients whose conditions could have been treated months ago if only the borders were open. The Israeli bombardment may have eased, but inside Gaza's hospitals, the war continues. Doctors battle chronic illnesses, untreated injuries, and a backlog of people in need that grows by the day. For thousands of patients, the wait for life-saving care has become a fight against time itself. Tareq Azzoum, Al Jazeera, Deir al-Balah, Palestine.